You need to watch this if you're inspired by Voices of Nova Scotia. Today, we're celebrating the incredible contributions of Nigerian healthcare professionals in Nova Scotia. These heroes bring their skills, compassion, and dedication to our communities every single day. From hospitals to clinics, their impact is felt far and wide. Join us as we honor their hard work and unwavering commitment. Stay tuned and be inspired by their amazing stories.
Hello and welcome to another episode of the Voices of Nova Scotia podcast. We're excited to have you here today. Can you introduce yourself?
Hi everyone, my name is Ranti Ogunmolawa. I'm a registered nurse here in Nova Scotia, Canada, and I currently work with the Nova Scotia Health Authority. I'm also a member of ENNS.
Can you tell us what inspired you to pursue a career in healthcare?
Well, when it comes to healthcare, right from my childhood, I've been a compassionate person and I love to care for people around me. So I just find it easy when I'm after high school, okay, what kind of career do I want to venture into? So I just feel like it comes natural to me to care for people. And each time I step my foot at work, I have the sense of fulfillment that yes, I'm doing what I'm supposed to do. And I derive pleasure in helping others to get better. Yeah.
What motivated you to move to Nova Scotia?
Okay, yeah. So when I was planning to migrate to Canada, I researched so many provinces. I looked at Nova Scotia and I found out that Nova Scotia happened to be the second province that has the largest number of seniors. So I felt like, okay, if there is increase in the number of seniors, that means there will be more job because seniors, they need care. And what I also discovered about Nova Scotia is they have increased in need of healthcare professionals. I feel okay, it will be a good place, and I discovered that it's a good community, it's a good province. I'm a kind of person that doesn't like to travel hours before I get to work. So I felt like in Nova Scotia, I can commute from my house to work within 20-30 minutes, which is still okay for me. So I feel okay, it will be a perfect place for me to come. And I also like the fact that it's a community-based, they have a community-based culture. They like that community integration. So I feel like okay, it will be a good place for me and my family to settle down. And that's why we are here. And we've been enjoying it so far.
Can you describe what your experience has been working with the Nova Scotia healthcare system?
Well, I would say working in Nova Scotia, first of all, I would say thank you to Nova Scotia Health for the opportunity to render my services and add my value to the healthcare system. I've had a mixture of pleasant and unpleasant experience. I will start with the pleasant experience. The pleasant experience, I've been able to work with good people, colleagues. My transition was made easy through the platform that was provided. There was a pathway that was provided for the internationally educated nurses. It is called Niche, and I think that will be the first of its kind in Nova Scotia. So I'm one of the beneficiaries. Thank you for everyone who's working on that. Thank you so much for that. So I came into the system. The orientation was top-notch. My manager and my preceptor, they made the transition easy for me. And there's always an education platform for you to keep learning and to keep improving your practice, which I really enjoyed as well. The unpleasant experience I had, or I've had in the course of my coming down to Nova Scotia Health is greetings. Where I come from a culture where we always greet. In the morning, we greet. In the afternoon, if anything happens, if you sneeze, we greet. If you eat, we greet. Anything you do, we greet. So each day I enter, I step my foot at work. In the morning, I say, hi, good morning, everyone. And no response. I was like, okay, is something wrong with me? Is it my parents? Is it that they don't like me or they don't want me? A lot of things kept going on in my head. And sometimes when I go to work, I develop anxiety at first that, when I'm going to a workplace where the the colleagues, they don't want to greet me and stuff like that, because I feel like anywhere I work, I want to build relationship with people I work with to gives me sanity, building and bonding with them. But I didn't get that. And the second unpleasant experience I would say I also had was the use of English. They want me to speak in they want me to use particular word they are used to. And each time I say those words, and they're like, oh, you mean this? In my mind, I was like, do you think I don't know how to speak English? Do you think I don't have good command of English? But then, I just spoke to myself that if I'm going to stay in Nova Scotia, I just have to develop tough skin against all of these to help my mental health, which I did. And I put my skill on the table. I put whatever I know, my past experience I've had in the past working in mental health back at home. I put that on the table. I became a good team player and everything fell in place. Now I don't have issue about greetings. I didn't change who I am anyway. I didn't change my culture because of that. I just move along with everyone, and yeah.
What challenges did you face when you arrived in Nova Scotia and in your practice with the healthcare system?
The challenges I faced when I arrived, I would say, I think I mentioned some, that most of my colleagues are preoccupied with starting the shift. They want to get ready for the shift. So when you greet them, they are going through the charts of the patient. So I guess maybe they don't want distraction. And one thing I also discovered that some of them, their personality, or maybe greeting is not part of their culture. So those are the things that I think I passed through. Then when I was coming into Canada, my expectation was pretty high. I was thinking, okay, coming into the healthcare is going to be modern facility, the structure, everywhere will be like heaven. Even the infrastructures, the gadget, they are going to be top notch. And the waiting period, I feel like, okay, there won't be a long waiting period. But coming here, the story is not the same. My expectation it wasn't what I was expecting at all. So when I came in, I was caught unawares because of my expectation. But then I just have to blend in, and okay, here we are. We just have to flow. Then another thing is the policies that they have at work. Where I'm coming from, the policy we have is totally different from here. So it was new for me. So I just had to unlearn what I have back home, and relearn the policy here and the way they carry out the practice here. So, those are the challenges I faced.
How has living in Nova Scotia changed your perspective on life and your career?
On life, let me start from perspective on life. Yeah, I love the community integration here in Nova Scotia. Everywhere you turn to, you'll find one community or the other, regardless of maybe you've traveled from the farthest country here, you still find your community here, which I want to give thumbs up for the Nova Scotia government for enabling that. It's a very good thing for us, and there are a lot of resources on ground for newcomers, which is also good. I mean, you don't come here and you're stranded. So there are a lot of resources for us to tap into, which is good. Also, I would say another perspective that I think has changed is the size of the family size. If you come here if you land in Canada, for instance, I'm from Nigeria. In Nigeria, we love having kids. In a family, maybe the least kids or children you can have is like 3 on the average. So if you are somebody that likes to have like up to 6 children, Nova Scotia will not give room for that, in the sense that we don't have enough childcare facilities here in Nova Scotia. And if you really want to have those kids, you have to be available for them. And if you are going to be available for your kids, that means you won't be able to work as you want to. And if you are not able to work, where's the fulfillment? You won't be able to develop in your career. Sometimes you are losing yourself, you are losing your self-worth, you are losing your goals, some of the goals you've set for yourself before you land here. So it has really changed. If you really want to make it in Nova Scotia, plan not to have too many kids, because I know the government is trying to provide solution so that there will be enough child care. Yeah. So I think those are the things that I've experienced so far. Yeah.
What can the government of Nova Scotia do to attract and retain more healthcare professionals?
Okay, in my opinion, I would say retention bonus. Yeah, I know that Nova Scotia is good with recruiting. They've been recruiting even internationally and locally. So I would say they can do better on that. And the retention, they need to work on the retention bonus, because for instance, you say it's all over the news that you give healthcare providers 10,000 retention bonus, but in the real sense it is not 10,000. After tax, maybe it's going to drop to like 6,000 or 5,000. Oh, that means you gave me 5,000 or 6,000. So if they can work on that, if they can make it tax-free, or better still increase it, then increase the number of the people they are recruiting, maybe internationally or locally, because one of the challenges that the healthcare system is facing in Nova Scotia is shortage of staff. So they need to increase on that. If you have more staff on ground, adequate staff to cover each shift, people will not experience burnout. So if they can work on that, yeah, that would be good. Yeah, I know there's a lot of advancement going on, a lot of projects going on in the Nova Scotia. I'll give them a thumbs up on that. But if they can also have technological advancement in the healthcare system, that will go a long way to ease our job, and maybe the review of some of the policies. And apart from that, they should see to the welfare of the staff as well. But one thing I've discovered is their focus is more on their patient than the staff. So if they can focus on the staff as well, because I want a place where you care about me. No, you care about my job, but you don't care about me. If you can care about me, that will make me stay. I will become loyal to you, in my own perception.
Has the Nigerian community supported you? If so, in what ways have they supported you?
Yeah, I would say shout out to the Nigerian community, the ANNS. When I came in 2022, I'm going to give kudos to the ex-president and the ex-welfare, because I have contact with them. So I don't know if they have other team members who's been working on it. But I would say shout out to everyone, all their crew members, everyone that supported them in those times. When I came in, I was pregnant. So they were able to secure a family physician for me on time, so that I could be seen. Then landing, they provided food for us that lasted us for like few days. Like, oh, this is good. I felt like I'm still at home, right? I'm away from home, but I feel like I'm home. Then we were able to connect. They introduced us to some people, which made us feel at home. We didn't really miss home at the first instance. Then when I gave birth, they provided some gift for my baby, and they've been so good. I'll say that. Yeah, I've benefited from them.
Thank you for joining us today. We hope to see you again in the next episode. Bye.
I'm sure it has been great exploring the journey of our healthcare heroes. Voices of Nova Scotia will be back with another episode. Stay tuned for more captivating stories. Whether you've tuned in from Halifax, Truro, Sydney, or halfway across the world, it was great connecting with you again to explore the great journey and stories of Nigerian healthcare professionals on Voices of Nova Scotia, where we celebrate our healthcare heroes. Thanks for joining us, and we look forward to seeing you again. Take care for now.